Hello, I was wanting to go over payment options for long-term care and nursing home. And basically, there's four options that are available, and just think your way through each of these. So the first one is, do you plan to private pay from your life savings? Private pay. And of course, this would be if you have saved up enough money and you think of maybe one of the spouse, one of a couple is in the nursing home, maybe paying $9,000 a month. You say, okay, how many months can I afford to private pay for out of my life savings? And if it's a single person, it'd be like one of my very first customers after I left Medicaid, and she had private paid. She had quite a bit of savings, a couple $100,000, and she had private paid for a year and spent down about $108,000. And finally, she said, is there any way that I could save or gift any of my savings to my grandchildren? Am I going to spend every penny of it in my care? And they said, well, you need to go talk to John. And to be honest, there are some special rules around how to do that. But private pay. And you think of a couple. I had another couple I worked with, and the wife was going in the nursing home, and her husband was still living at home in the community. And they only had 50 or $60,000, but they, there were special things that they needed to do in order to preserve those assets for that spouse in the community. And so, is private paying the best answer, or will that impoverish the spouse that's still living at home? And to be honest, there's rules around how you can minimize the cost for private pay. But some people just choose to private pay, and that's one of the options. The second one is, what about long-term care insurance? Now, some people have purchased this previously. Long-term care insurance for a while was really good, but then the insurance companies quit making money on them, and then it got really expensive, and very few people bought it. And then they've started doing some new things with life insurances, saying that you can like buy $100,000 policy, and then if you need long-term care, you can withdraw early against your policy. Probably some penalty to that, but anyway, if you don't have long-term care insurance already, or don't have a life insurance policy that does that, and you're needing care right away, well, it's too late, right? You have to buy the insurance prior to needing the care. You can't wait till after you have a car accident before you buy the car insurance, and you can't wait till you need long-term care before you buy the long-term care insurance. So a lot of people have missed out on the opportunity to do that already. The third option is, of course, if one or both of you are a veteran. If you are, then explore those options with the Veteran Services. They have programs that help pay for in-home care, assisted living, and nursing home care, or some can qualify to be in a veterans facility. And then the last payment option is nursing home Medicaid can often help, or long-term care Medicaid. Now, don't dismiss this out of hand. The rules are written to help couples. And I kind of alluded to that already, but I was able to help that one couple. The wife went into the nursing home. The couple had about $60,000. We were able to help the husband, position his assets according to the rules, and she qualified for Medicaid the very next month, and they didn't have to waste any of their life savings. They were able to preserve it for the lifetime of the spouse that's living in the community. So there's lots of things around that. Some people are nervous about Medicaid, I guess, long-term care Medicaid. And there's a couple reasons. I'm not exactly sure why, but sometimes some people think it's disgraceful, as if long-term care Medicaid is the same as being poor. And to be honest, long-term care Medicaid was carved out of the Medicare program. You paid for it during your working years, just like Social Security and the basic Medicare programs. And it was carved out of the Medicare program because preventive medicine is better or cheaper, more cost effective than emergency medicine. And it's easy to see the example there. If you have somebody that doesn't have the care that they need at home, and so they get dehydrated, or they get urinary tract infection, and then go to the hospital, and there they get the better care. They get hydrated and fed, and all of those things, the right sanitation and care that they need, and so they get better, and then they go back home, and again they're left to their own devices, and they forget that it's hot outside, and they don't want to drink their water, and they don't want to eat right. Pretty soon they're down again. And it's kind of like the story about the mountain road, where there were several accidents on a certain curve on the mountain road, and someone said, I have a great idea. Let's build a hospital at the bottom of the mountain, so that every time that there's a wreck on the mountain road, that we can We can take them to the hospital right close. We don't have to go far away to get to the hospital. They'll be right there. And, somebody else said, it'd probably be more cost effective if we just put a good guardrail on that curve and keep people from going off the mountain. It's more cost effective, right, to build the guardrail than to build the hospital. So that's kind of the idea with nursing home Medicaid and Medicare. But anyway, those are your four options of how are you going to pay for it. I just would encourage you to not exclude Medicaid from your thinking process, especially if you have a spouse in the community that needs to live off of your life savings. So that's my little explanation of the payment options. I'd be glad to hear what you think about it. Have a great day. Thanks. Bye.